welcome to Get to the Root of It. I'm your host, Laurel Brennan, and I'm thrilled to have Dr. Jaquel Patterson with us today. Hi, Dr. Patterson.
Hi, I'm so glad to be here. Excited to be part of this podcast today.
So, Dr. Patterson is a nationally recognized naturopathic physician, success coach, three-time Amazon bestselling author, and Forbes contributor. She owns a successful multidisciplinary medical practice, Fairfield Family Health in Connecticut. She has over 16 years of clinical experience with a focus on Lyme disease, autoimmune conditions, integrative psychiatry, and environmental medicine. She is a sought-after speaker and published in places like USA Today, New York Magazine, Forbes, and has been on many TV stations, Fox, NBC, ABC. She has also completed additional training and is certified with the Institute for Functional Medicine and Functional Medicine for Psychiatry and ADHD with Psychiatry Redefined. She is active in leadership within the profession, serving as the past president for the American Association of Naturopathic Physicians, and currently serves on the board for the American Academy of Environmental Medicine. Quite an impressive bio you have there. We're really grateful that you took time to be with us today. Thank you.
Thank you. And I'm grateful to be here. So thank you for having me again.
So I found you through a webinar that you gave on Lyme disease. And at the time, I had recently been bit by a tick. It's a little nymph tick that I found, 24 hours after a hike. And that was my third experience. So I was searching for information. And then when I found that you had multiple areas of expertise, I was very excited to learn more from you. I wish I could just download all your knowledge, but of course that's not yet possible. So I'm excited just to learn what we can from you in this time together. We're going to have two kind of focal areas: Lyme, which was the reason I found you initially, and autoimmune disease, because that is personally has impacted me. I have multiple sclerosis. My mom had chronic fatigue syndrome, and many of my clients who come to me for subjective cognitive decline, brain fog, also have autoimmune disease. So first, I want to hear a little bit about your journey so we can just get to know each other and the audience can get to know you. What brought you into the field of naturopathic medicine?
Yeah, so I was actually always interested in integrative medicine, herbal medicine. I went to initially Cornell undergrad as a plant science major, so I had an interest then. But I think my biggest story was I definitely have many family members that have done the allopathic conventional route. But at around 15 years of age, my mother came down with the autoimmune condition, which was lupus and rheumatoid arthritis. And that's where there's that, tie-in for me continuing to have practice area of focus of infections and also autoimmune conditions. And so during that experience, I felt I became a little bit disillusioned with the conventional model and really looking at, how did it happen? Why did it happen? What was the impact of stress on, because she had a significant stressor right before she was diagnosed, and also feeling like she was kind of missed in care. And that time forward, I just said, I want to do medicine in a different way where I have time to really look at the whole person. And I didn't feel I was actually in a track to go to medical school without even the MCAT. But I knew for me, it just wasn't a good fit. It just didn't feel like it was a right fit. So I went to, undergrad, hadn't heard about naturopathic medicine, didn't know how I could do that, because there wasn't really at that time. I've been practicing for 16 years, but the only person I had heard of was like Dr. Andrew Weil. Now functional medicine is popular. Now integrative medicine is more known than 20 something years ago. So when I graduated, I worked actually in the food industry. I was in the business field for few years, learned about naturopathic medicine. And I was like, this is exactly what it was that I wanted to do. I just didn't know what it was called. Went back, took all the pre-medical requirements, and went into naturopathic medicine. So that has been, I think, something that I've always thought there was a better way of delivering and looking at a person holistically. And so naturopathic medicine does that, functional medicine does that. And I'm so glad that it almost felt like, I landed into exactly what I wanted, but again, didn't know what was actually called. So,
yeah, I'm trying to tell my daughter the same thing, that sometimes you have to do things before you realize what it is that is your path.
Exactly.
I came to occupational therapy kind of through psychology and then social work and then found occupational therapy. But I also
And
did
they
not
all
know
build. They
what.
they all build. I always tell,
Yeah.
like, young people that they all build upon each other. Like, my background was also in, like, business and economics, and now I
Mhm.
run, a thriving practice with 9 other providers. Well, it helped that I had my business background for that. So I think sometimes you don't really get it until you're past that mark into experience, and I always tell people it's okay to change your mind of what you wanna do with your career, like, a zillion times in your lifetime. Just try to follow what you feel like you're most passionate about and that you're drawn to.
Yeah, awesome. Good advice. So you gave some background into why autoimmune disease is important to you as
Mhm.
a focal area in your practice, because of your mom. Now, I also know that you live in Connecticut. So is that why you also have a focal area of Lyme disease?
It was the same, and actually, family members that had Lyme disease, I myself, so how it kinda started was I started seeing patients, that had Lyme disease, that had Bartonella, Babesia, other tick-borne diseases, and when I was in naturopathic school, I had, I had a lot of fatigue, some alternating joint pain. I had brain fog. And my brain fog was like a little bit of a disassociative where I felt like I was watching myself,
Mhm.
and really bad anxiety and a lot of heat intolerance and sweating. Like, just, I would be completely drenched for like 1 or 2 years. I was wearing all black. And so during that time, when I went in to see providers, I went to, 5 different doctors, went to a rheumatologist because obviously I have the family history. So they thought it could have been autoimmune conditions, but everything kept coming back, vague. I had some autoimmune markers, but not significant enough for a diagnosis. And they kept saying what my patients are always told, it's you're anxious, this is just anxiety. And I did have some of that, but this felt different. I'm like, I'm not anxious going to a grocery store and I'm completely drenched. Or one day my knee hurts and then 2 days later my arm hurts and my knee doesn't hurt anymore. I'm like, this isn't in my head. So when I started seeing patients, I started, treating and diagnosing, and I'm like, wait a second, this is all the symptoms, it's like these are the things I had at that age. At that time, I did a lot of lifestyle changes. I did a lot of self care. I did do some herbal protocols for, like, immune modulation. Wasn't directed to, Lyme disease at that time. And so I'm like, let me test myself. And sure enough, positive, like IgM, Lyme disease, Babesia, all of those infections. My father also had Lyme disease where they thought it was a spider bite by the way it looked. And I said, Dad, that might be Lyme disease. And sure enough, he checked. He was tested. My dad's 80 now, but at the time he was like 74. And he's a person that goes outside, cuts trees, still does manual labor, will go on the roof, everything. He's like, well, maybe I'm just getting older and it's hitting me now and I'm slowing down. I'm like, something's wrong. So we checked and he was positive. So even a few years ago, I found one on myself that was a small, literally as a ballpoint pen. I actually thought it was a freckle. And I was like, oh, when did I get a freckle there on my shin? And I'm like, oh, that's a tick. So it could be that small. So people often miss it, and you don't get a rash. Only like 40% of people will or 50% of people will get a bullseye rash. And so it came from a place of getting into Lyme disease from the patients I was seeing, but also having my own experience where patients actually informed me to go back and look to see, what those symptoms I had previously, what those might have been connected to.
Yeah. So I'd like to dig in a bit to Lyme. That is actually the journey that pushed me into learning more about functional medicine because my daughter, who's now 21, when she was in third grade, got a tick bite. When she was in fourth grade, got a tick bite. When she was in fifth grade, she got a tick bite. And the pediatrician at the first or second time basically told me I was a crazy mom,
Mm,
that this rash wasn't Lyme. And she did a rapid test in the office and it was negative. And she said, see, I told you it wasn't Lyme. But then as the years went by, she kept getting more and more like concerning symptoms in middle school, which is a time of stress
mhm.
anyway. But she was
Changes.
like overly anxious and depressed that I thought, I think this might be connected. And then like some neurological issues where tingling and numb only one side of the body, but then it would disappear. And then, of course, that scared me because I had MS. And tingling and numbness was one of my early symptoms, but it came and went. And it wasn't until we found a Lyme literate doctor, multiple years later, where she got treatment. Um, but I want people to know, like, okay, number one, you shared about a freckle that was actually a tick. What and your dad thought it was a spider bite. What are some of the um, what do you advise your patients to basically to look for?
Mhm. Yeah, so one of the things is, well, prevention is really important. So being mindful too when you're going outside and coming in the house. I always tell people to wear like light color clothes, like whites and things like that, so they can actually pick up and inspecting their body. And they usually ticks will burrow in like your underarms, like usually areas that are more hidden in the hair and the scalp, etc. But you typically when people are getting it, some people, if they're overt symptoms, they might get a fever, like a sudden onset of a fever, headaches, joint pain. And one common thing of like Lyme disease versus autoimmune conditions is you'll have alternating joint pain. Like let's say you get rheumatoid arthritis, they tend to be localized in your hands or your wrists, etc. With Lyme disease, you'll see like all of a sudden, the shoulder hurts and then the knee hurts. And so it kind of doesn't match typical to like
Mhm.
a traditional arthritis or an autoimmune condition. You can get even swelling. The most common joints affected are knees. So some people initially they'll get like a lot of knee swelling or the hips. Those are two areas. It can affect many parts of the body, but those are the most common joints that are impacted. Brain fog, a lot of fatigue. And that migratory joint pain I mentioned is pretty common. So those are the initial symptoms. Oftentimes, if you get a bullseye rash, that's great because it's really clear, like this is Lyme disease, and you get the symptoms after. But people can also even get neurological issues. I've had patients with Bell's palsy right after they've gotten a tick-borne illness, or immediately having coordination issues or dizziness or neuropathies. So that can often develop over time, but you can have these sudden neurological changes as
Mm.
well that occur.
Okay. So is there like a window for treatment when it's more beneficial to find out, "Yeah, I got this tick bite yesterday, this I'm going to treat it now?" And what do you do if you got that tick bite 6 months ago?
That's a good question because that's actually one of the challenges. Most people, same as with autoimmune conditions, see about 5 to 9 doctors before they're diagnosed with Lyme disease. So often, unfortunately, because of that, many of them have already had it, for 6 months or a year or years
Mhm.
before they actually get treated. And so the typical course. So if you do find a tick, one of the things I do, like when I had mentioned the one that I thought looked like a freckle, I removed it, put it in a bag, sent it out. A lot of the city departments or even some of the lab companies that focus on the Lyme literate lab vendors will actually test the tick too. So that's also helpful to be clear. But oftentimes you won't, if you have antibodies, when you look at the Lyme testing, there are some now tests that are called T-spot testing, and that can actually show the antibodies in less than like 4 weeks. But for the most part, our antibodies for Lyme disease or other tick-borne diseases won't show for 4 to 6 weeks. So
Mm,
that's tricky because I have a
mhm,
lot of patients, and you probably know too, Laurel, well, they'll say, "Oh yeah, I got bit and I went and got tested and I was negative, so I don't have it." And I'm like, "Well, it takes 4 weeks to develop those antibodies, so it's too early." So typically that's why they're looking at those physical symptoms like bullseye rash and things, but then again the challenge with that is not everybody gets the bullseye rash. So it's kind of a tricky thing if you do have the clear bullseye rash, fever, joint pain, migratory pieces, it might make sense, and headaches, to prophylactically, if you're going to a doctor, they may put a patient on antibiotics for as short as 2 days, typically no more, unless it's confirmed with the bullseye rash, than 3 to 4 weeks in the conventional model. However, the replication could be up to 12 days. So you really want to make sure, I tell people that it's at least a 2 or 3 week mark at minimum. Like 2 days, 10 days is could be not really fixing it. And I have a lot of patients that will be told that, like, "Oh, I did it for 2 days, so I'm cleared." So you want to definitely, if you do that, it's early on, you have a bullseye rash, they give you antibiotics. Let's say you do want to test in the 4 to 6 week mark again and not think it's just completely done with. Now, if you've had it for a long time, that's the tricky part. We in our practice, I'm a naturopathic physician, so we do integrative medicine, but we have many patients that have been on antibiotics for years. The challenge with that is they often have to change up the antibiotics pretty frequently. They're also yeast forming, so people can get some issues where they need to be on antifungals. Also, it also when it's long-term symptoms, you have what's called stationary phase, and it's just harder to really get at it. And so that's why you have to be on antibiotics longer. And this is where I really like the herbs, because many of the herbs we use have been studied and shown to be as effective as antibiotics. But the other great thing about integrative medicine is you're also supporting the immune function. So lots of times when you're doing antibiotics, it's helping to pull things. But then when people get off the antibiotics, they kind of crash because their immune system has been depleted and their microbiome has been also strongly impacted. So there's kind of two courses. So if it's long term, typically you're on it for a longer period of time. Antibiotics, if you go to a Lyme literate doctor, and or with us, we do integrative medicine, which we do about for 6 to 9 months. Typically, treatment is going to be at least a year when you're looking at it when it's been a long time.
Okay. And you mentioned testing
Mhm.
earlier. So maybe depending on what practitioner someone goes to, they might just do a lab core test. You
Mhm.
mentioned IgG. What do you recommend
Mhm.
for acute and then follow up, maybe chronic Lyme testing?
Yeah, so if you could get, so if you look at some of the conventional labs, they it's more likely to be false negative. So that's the first thing, because I do have people that'll say, "Oh, well, was it a false positive?" I'm like, it's way more likely for it to be false negative than false
Mhm.
positive. So that's the first thing. Conventional labs sometimes are a good place to start. However, they miss in some of the statistics like 40% of positive like findings. So the immunoblot is really the best if you can get an immunoblot done. At minimum, I tell people if they're getting it through the conventional labs to do Western blots. Oftentimes, if you're going, they'll first do what's called an ELISA test, and then it'll reflex out to a Western blot if the ELISA test is positive. The problem with that is if 40% of people are negative, you're never going to actually ever get to the Western blot. So they have the choice of doing a Western blot. Immunoblot is more advised. And what you're going to check for is what's called IgM and IgG antibodies. So IgM typically means like less than 3 months. IgG is greater than 3 months in terms of the infection. But you can have an individual like myself who is IgM years later if it's active. For me, for example, mine became active again after I got sick, after I got COVID. It turned on to IgM. So
Mhm.
sometimes you'll also see that where it can get kind of reactivated, it's not a current infection, but IgM will actually mean it's active. So ideally, at minimum, the Western blot rather than the ELISA test. And if you can go to a Lyme literate vendor like IGenix or medical diagnostic labs, the accuracy of the test is going to be a lot better. And immunoblot would be ideal if you're able to do that.
Okay. Yeah. Thank you for that clarity. That's super helpful. Now, you mentioned, are all those things just testing for Lyme? What about the
Yes,
co-infections?
the co-infection. So thanks for saying that. So you also have immunoblots for those other common tick-borne infections. Some of the other common ones are Babesia, and that's you can test Babesia immunoblot. Now there's different species, and that's one of the reasons, which I didn't mention earlier, there are so many false negatives because they're even now testing. They just had a whole bunch of funding to test to find recently a lot more subspecies of, for example, Borrelia. So if you're looking at, let's say, some of the conventional labs, they might test for just B31 and let's say one strain, whereas when you're looking at some of these Lyme lab vendors, they might test for 8 subspecies. So the same comes with when you're looking at the co-infections, like you have Babesia microti, you have Babesia duncani. What happens if you have microti, but they tested the other one? It would be negative, even though you have it. So that's the thing that in research I think is continuing to evolve is that there's many different subspecies strains of those co-infections. But if you can get the same as the other Babesia immunoblot, Bartonella is a common co-infection, and that tends to affect your neurological system more. Like you'll see people with more neuropathies. Rocky Mountain spotted fever is another one, and also depending on the region you're in. So, for example, Rocky Mountain spotted fever, I might test for somebody depending on like the location and where they live. If you're looking at somebody, for example, in California for Borrelia, like for Lyme disease, they might have the subspecies Borrelia afzeli, which is more common there and in Europe, European strains. So that's also really good with the history taking or just anybody listening in. If you're a person that travels a lot to different areas, there are also different types of species that you might get exposed to that are not tested correctly.
Okay. Yeah, thank you for clarifying there as well. So do you see people from all over the place, or do they have?
Yes, we do.
Okay.
Yeah, we do. And actually, about 40% of our practice ours isn't even in Connecticut. We do get a lot because we're by Massachusetts, New Jersey, where they come in, New York. But yes, we do. We've even had patients in Europe and Spain and Brazil and different locations because, unfortunately, in some of these places, especially outside of the Northeast, it's it's even less understood. Like even in Connecticut, we have trouble with people, actually doing the lab work or even believing it's true or believing the symptoms, let alone if you're out in different states where there's less there although they have found it in I think like 48 states or 49 states, but there's less awareness of it in different states, and so it's even less likely to be tested, especially in different countries.
Yeah. I think when my daughter finally found the Lyme literate doctor, we found somebody for her. She was like 3 months into her treatment, and I got a tick bite. And I thought, oh, I got it off soon enough. I think maybe
Mhm.
I'll put some essential oil on it, and
Which is
I
helpful.
and I really I didn't get tested, but I had a visit with my daughter's doctor several weeks later, and she's like, "Well, you probably want to start treatment because I hadn't saved the tick, so there was no chance of testing it, which I highly recommend nowadays because I've used tickreport.com and
Mhm, mhm. Yep,
um,
that's a good one.
yeah, so relieving to get that report back because my recent lymph or nymph tick um, was negative, which I was
Awesome.
very happy about for all the things. I paid the $250 to test all the things, but historically, I don't know if I've really gotten rid of it, and I kind of want to kind of go down that road. Do you ever get rid of it if you have chronic Lyme? So after I got that tick bite, I didn't treat it. 5, 6 weeks later, I started getting wrist pain on that same arm. So I got bit at the elbow, got wrist pain. So the doctor started me on antibiotics. My daughter was on antibiotics for a year, was on
Mhm.
antibiotics for 9 months. We both got hit with norovirus and were completely depleted. And I decided we're done with antibiotics.
So this is exactly kind of what I was talking about. It's like that's what'll happen is that
Yeah.
someone gets sick or they get off the antibiotics and that's what I see. There's just kind of like, and so I think there has to be a baseline support that's given to you so that you don't have that crash and burn kind of
Yeah.
thing after you get off of it.
So, what do you recommend to your patients in addition to antibiotics and herbs? Are
Mhm.
there other lifestyle things that can support your healing?
Yeah, so some of the things for Lyme disease that have been studied, like far infrared sauna. So I do look to have people do that. However, when someone has any tick-borne disease, I try not to push you too much because what happens is same as and you'll see with exercise. I've had patients that um have been marathon runners or or have done marathon running, biking. I'm trying to think of what the name of that is called, but like some like very intense level of exercises, and they
Yeah.
tell me they got a tick-borne infection and they're like, I can't even run like 2 blocks. So so that's a drastic life change for them. So some of it with tick-borne diseases too, the mental part it is I always tell people is considered a trauma in my opinion, when especially if you've been dealing with it for a long time, because you have individuals that have been fine and well and healthy and doing Ironman and things like that, and then all of a sudden they can't do any of it. You could feel helpless, you could feel like really defeated and also frustrated because there's nothing that you saw it coming. And
Mhm.
so lots of times I'm building them back into like exercise and movement. However, humidity, exercise, et cetera, can actually make someone, when you have tick-borne disease, feel really bad if it's too long of a time. So I try to do it very short increments of, let's say, 15 minutes. But far infrared sauna is one of them. Hyperbaric is another one. Hyperbaric therapy has been shown for like chronic diseases and for some of my patients with neurological and brain fog and focus issues. That's really helped them pretty significantly, which are these oxygen chambers basically, and the treatments are about 45 minutes. Some people also do well with other medications like low dose naltrexone, which is used as a help as an anti-inflammatory. So a lot of my patients that have autoimmune conditions plus Lyme disease, LDN tends to be something that's also helpful for them. Typically with diet, I look to do things that are more like what they call like alkaline or less acidic, or because of the fact that Lyme just does really well in acidity, and that's why you'll feel worse when you're exercising too much or a lot of humidity. So we'll look at that by way of foods, staying away from the major things like gluten, dairy, processed foods, like any of those major factors. Also, it's really important to look at any other environmental factors that could be negatively impacting someone's health. Like mold is a huge one for people with tick-borne diseases because it can suppress your immune function. And so I want to make sure they have good HEPA filters, good air quality. I'm going to ask somebody like their living situation because sometimes that could be more of the issue than the tick-borne disease. So we want to look at everything: environmental influences, their diet, lifestyle. Like I said, even therapy we've had for people that can help them as well, especially after getting diagnosed, and as much movement as you can, but just being taking in consideration the extent of which you are getting movement when you're first diagnosed.
Right. Right. Yeah, it was our Lyme literate doctor who cued us into the possibility of mold, and it turned out that the house we were living in had mold in the HVAC system.
Mm-hmm.
So
You'll be surprised at how many people, and I'll have patients that are like, I can't have it. My house is only 5 years old. And
yeah,
I've had one or like at least a handful that have been really new. Like it's been in less than a year and they found out problems with their house or the HVAC systems weren't properly installed or in terms of things being set up the wrong way. And they are surprised to see how much mold is in their house.
yeah, yeah. And earlier when you were saying that, at least 48 states have been tested positive for Lyme, when my daughter and I went through it, and it was like, I got a second tick bite. She got multiple. I mean, we live in Maryland. We like to hike. I want to talk to you about
Mm.
that. Like how do you balance like the love of nature with I don't want
Hmm.
to get Lyme disease again? Um, but yeah, we were searching where in the world can we move to where there's no Lyme, and it was not really anywhere.
It's really not anywhere. Because I've had
I
people
guess we'll
say
just
that. They're
stay
like,
where
"Oh,
we
I need
are.
to move to Texas or I need to move to a different place," because the balance is exactly what you said. Like nature, there's so many health, it's actually an indicator. Like there's so many health benefits of being in nature. So you have a lot of people scared of when I'm talking about grounding or hiking and
Mhm.
those things of like terrified. I don't think that's good either, but I think you have to just take a lot of precautions because that's equally as beneficial for our health. But I understand the fear that would obviously come with that based on those experiences.
Yeah, yeah. I'm still trying to find that balance because I used to hike every Friday with a good friend,
Oh, that's nice.
with our dogs, and it was such a uplifting experience. It was good exercise. It was
Mhm.
in nature. You're socializing. Your dogs are loving it too. But 3 times I got a tick over like a 10-year period, twice that led to Lyme from those hikes. And I'm like, okay, where can I hike? Do I have to hike like on a road with like, you know, a barrier and there's trees like 10 feet away from the paved space? Like, I want to still be connected to nature. I'm going to Costa Rica on Thursday.
Oh my gosh, that's one
I
of my
love
favorites.
I love being in nature. I feel better in nature. I want to encourage my clients to be in nature. How do we prevent it? I mean, now I just say do a full body check every time you come in. Like I take off my clothes, put them in the dryer,
Yep, and for 10 minutes at least.
then wash and dry, get a shower, full body check. I mean, that kind of takes away the joy of camping for some people, because if you get a tick bite, at 4 o'clock in the afternoon, and then you spend the night and you're in the dark and you can't see, you don't notice it until 2 days later. Are you past your window?
It's true because it could get, I mean, typically before it used to be like 36 hours it had to stay on. Then it was 24 hours, 12 to 24, but now they're showing like some infecting in less than 4 hours. So that's another thing people will say, well, I found it fast enough, but it's like, but how do you know too? Because you don't even know like how long it was there.
Mhm.
So that's one piece. But there are companies out there, like Insect Shield is one. There are companies that will actually use, it's a chemical but called permethrin. And so for my patients that like hike a lot or gardeners, et cetera, they actually will treat your shoes. So, you're not touching your shoes, but because they've shown like pretty significance, but above over 70% for like the ticks getting on you. So they're treated, boots and shoes that can have it, that can also prevent, can be helpful with the ticks. And then there are some companies that will actually treat your clothes that you're using for hiking that will last up to 70 washes. So I have some patients that will do that, like going into the spring and summertime. So like it can't cling on. But obviously we worry about chemicals and things like that. So that's why I'm like, shoes are the kind of the easiest because you're not necessarily touching it. But it's a great way of preventing it. And then there's also sprays. Like at our office, we use Ranger Ready, which is shown to be as effective. It's FDA cleared as like DEET, because you have to be careful with things like DEET. And so that one has a picaridin spray that's shown to be effective, especially also for ticks. So you do as many things you could do as sprays. Like if you're really hiking and out there a lot, I would definitely suggest doing like the treating of your shoes, your hiking boots and things like that. Keeping kind of the same consistent clothes again that are light, where you can see those things. There are some essential oils, like cedar oil, things like that people use and put on themselves, eucalyptus, things like that to help. And then also people even spray their grass with some of those oils as well to help prevent ticks as well. And then the other thing I forgot is a lot of people like me have pets. So that's another thing. A lot of people are letting their pets on their couches, on their beds. And I think we forget about that, because I have a lot of patients, they'll say, well, I don't hike, I don't go out in the woods, but they have several dogs. And I mean, my dog in the summertime, I'll walk her even sometimes on the pavement and I'll come back and she has like 3 ticks on her. Like she didn't even go on the grass. I'm like, how is this happening? So animals are great ways to carry it too. So just being mindful of, like, as if you can. I know we have all our animal, like a lot of people, animal lovers. I don't have mine in the bed because that's a way of definitely getting it. And a lot of kids, the rates of getting diagnosed with tick-borne diseases is the highest for kids, and kids love pets and are usually on them more and attaching and clinging and hugging and such. So that's another big area to look at that I think it gets overlooked often.
So what do you recommend putting on your pet, if anything?
So there are some natural like collars that they have to prevent that. I spray mine too as well with the same stuff I use for myself. And then when they're coming, I'm just checking every single thing. I'm brushing her out, looking usually for her. There's a lot like in the feet. They'll usually go like by the ears and on the neck. They try to kind of hide. So you definitely want to feel and see if you see anything implanted. The challenge is with dogs, it's hard to see, unlike with humans. Like let's say it's on their head, like it's harder to see the tick because they're because of the hair. So you'll typically will see it after it gets engorged and it started, unfortunately.
Mhm.
But you can see them when they're like getting up and it's on the couch or it's on the bed, etc. But as much as you can do, like brushing them out, collars, sprays, etc., as much as possible.
Okay. You mentioned you use the same thing on your dogs that you use on you. Do you mind sharing what that
Oh,
is?
yeah, so I use the Ranger Ready. The reason
Okay.
I like it is it's they have different scents, but I use scent 0. I don't like the only thing is when you have a 0 scent, then you end up spraying more because you can't smell it, so you don't feel like it's on, so that doesn't bother, obviously my dog because
Okay.
they can't smell anything, but a lot of them are like, as you know, a lot of those sprays are pretty pungent smelling, so.
Yeah. Okay, that's good to know. I was unfamiliar with that one. Ranger Ready. Check that out. Thank you. Okay, so back to my question about can you ever get rid of it? So if you have Lyme um, and you're treated with antibiotics and herbals and you've done a year of treatment, are you cured?
That question always comes up to my patients, and they'll often say, how long am I going to deal with this? Am I going to deal with this forever? That's always a hard question to answer, because I've had patients that have had Lyme disease for 10 or 20 years. So the biggest thing is with Lyme, when you look at Lyme disease, it technically is a clinical diagnosis, and that's per CDC. So it's not only the lab test, but also the clinical symptoms. So like for example, I still might test positive for IgG. Do I have the symptoms of Lyme disease? No. So I have to tell patients, like, we want to
Mm.
look at that also with symptoms. I will have people check um, typically, during the time of treatment, and then I might tell them test again like 6 months or a year later. But I always tell people focus on the symptoms. Typically, I say the first few years of treatment, in my experience, we want to see what things are going to be aggravators. So typically, like a lot of stress, I've had patients where stressor, because anything that's going to downregulate your immune system, that can cause an issue. Immune system, like I'll have patients fine, and then they're like, I got the flu, or I got COVID, or had a really significant event, and then they're like, I have my Lyme like symptoms, and I'll test, and it might be positive. Or I also have like women that are going through like perimenopause, or even menstruating women where they're like, I feel like I have all my Lyme symptoms like a week before I got my menstrual cycle, or I have, is this hormones? Because we know hormones can cause brain fog too. And so they're not sure, do I have Lyme disease again? So what I tell people is to look like, are those symptoms consistent with what you had before? Is it exacerbated? So if you had brain fog, does it feel like the brain fog before? Is it different? Kind of looking at that, retesting. I definitely I have a lot of fear of that with patients, of like, am I going to have this forever? I would say I have the opinion of, you might have the bands that show, but are you going to have it forever? I don't think so clinically, where a lot of people won't have any symptoms related to it at all, but we definitely want to treat it. And the reason is, there is definitely a connection with like autoimmune conditions. So when you look at autoimmune conditions, on average, individuals with autoimmune conditions, especially lupus, mixed connective tissue disorder, rheumatoid arthritis, and MS, have at least 2 or 3 persistent and chronic infections. So lots of times when I have autoimmune conditions, I'm testing for that. And the reason is, I worry that, like, when I tested my mom, she had Rocky Mountain spotted fever. She didn't get tested for that. I just was curious. I was doing an investigation to say, like, let's
Mhm.
see if she has these infections. She had 3 or 4 infections, but if they aren't treated, like how you did with antibiotics or herbal medicine, or et cetera, can then that possibly lead to triggering an autoimmune condition by ways of things like molecular mimicry, bystander activation, et cetera. So my concern with it long term is that we don't want to prevent a chronic, autoimmune condition in the future, or an inflammatory condition in the future, and we want to treat it. But do you have to have it and struggle with it for your whole life? No. No.
Okay. You have a good segue into autoimmune disease. So, for those people who might not know, what is molecular mimicry? What is an autoimmune disease, and how can Lyme and autoimmune disease be connected, related,
Mhm.
or influence one another?
Yes. Yeah. So there's over 80 autoimmune conditions, and autoimmune conditions are where their body mistakenly attacks itself. More common in women, and typically, in their 30s to 40s. Women are more likely to get diagnosed with autoimmune conditions too. Perimenopausal. I see also after pregnancy, where there's also hormonal shifts. And I actually present a lot on that. And that's one of the reasons why I wrote my book, Women in Lyme. There's definitely a connection with that and hormones, because hormones in many ways are really protective. When you look at things like progesterone and testosterone, they're actually anti-inflammatory. And when we get into menopause, or really over our 40s, all of those hormones start going down. So all these things that have been protective for us are not there anymore. And it might be one of the reasons why women are more likely to have autoimmune conditions than men, because they don't have those same drop downs, except for maybe a little bit with testosterone. So that's important. So when you look at, there's 3 different possible ways for like causing kind of immune dysfunction that can be triggered up by an infection for autoimmune conditions. And we have what's called molecular mimicry, is one of the most common ones. There's 2 other ones called bystander activation and epitope spreading, but molecular mimicry has been shown when there's these like infections. The one most connected is EBV. That has been correlated with lupus, has been correlated with Hashimoto's, where over 85% will show like EBNA high antibodies. Even actually, when you look at Alzheimer's, Parkinson's, there's been connections with like hepatitis C, HIV, and these as it pertains to molecular mimicry. And basically, what it means is it looks like it. And so your body starts attacking itself. It's kind of like beginning that process. So that's how these chronic infections can possibly lead up to an autoimmune condition. With Lyme disease, they've connected it with MS. They've also connected with rheumatoid arthritis. I'll see a patient that I'm treating for rheumatoid arthritis, and they never got tested for Lyme, We look at that, we start treating them for Lyme disease, and guess what? Their rheumatoid factor goes down. They have no rheumatological symptoms. They get off their medication or they're down on their medication. And so, what was the preceding factor? It could have been getting this infection that wasn't treated, and it was just treated as an autoimmune condition. Sometimes I have it the other way too. I have some people that have had Lyme disease for 10 or 20 years and they had an autoimmune condition that never got worked up, possibly. So it's like a chicken or the egg thing. But molecular mimicry really is about beginning that system where your body kind of mistakes itself or starts attacking things that look like it and kind of stir the pot to begin the creation of potential autoimmune condition down the future, down the way.
Yeah. And for someone who might not know, EBV is Epstein-Barr virus or mono, right?
Mhm. Yes.
Okay. That I had
Thank
that
you
in
for
8th grade.
clarifying that. And a lot of people will have Epstein-Barr viter titer. So that's one thing to know because some people get really nervous when they see that. A lot of people have it. But the biggest thing is we want to look, is it EBV IgM positive? Is it early antigen? A lot of docs don't check what's called early antigen, which means it got reactivated. So that's one that's important to check because it's really seeing like how much it's influencing your current state and your disease condition.
Okay. So the only three, there are three potential ways that autoimmune disease is triggered. The only one I was familiar with was molecular mimicry. What were
Mhm.
the other two that you
Yep, so it's
mentioned?
called bystander activation. And bystander, I always say it's where it's like more acute. So molecular mimicry, it looks like it, and then your body is like kind of copying and thinking it's that infection. Bystander is where it's just like a very strong inflammatory response. I say it's like
Mm.
your house is on fire and then all the houses next to it, have it. So kind of like what happened with COVID, where just like it's this super pro-inflammatory cytokine response, but that can cause then this like autoimmune condition. And the other thing is called epitope spreading, where it's spreading to these infections. It's a chronic and persistent infection, will start confusing the body, and it'll start doing what's called epitope spreading, where it's spreading to different organs and things like that to activate an autoimmune condition. But yeah, a lot of people just know molecular mimicry, but they're kind of connected a little different. Like you look at bystander, I said it's like kind of more with like like rheumatoid arthritis, where it's like that strong inflammatory response. Epitope spreading, I would equate to disease conditions like lupus, where it's affecting different organ systems, and it's from chronic and persistent viral infections
Mhm.
that can cause this issue, both of that and bystander activation, whereas molecular mimicry could be just a recent infection that can kind of mislead the immune system.
Okay. There's something I've thought about and wondered if anybody has studied, and I've asked a few friends who might know, and I'm going to ask you because I haven't gotten a solid answer. Maybe nobody knows. Okay. So my daughter and I did not have a strong immune response to a tick bite,
Hmm.
but some people, I have autoimmune disease. I'm I'm not putting anything out on her, but I'm concerned that that
Hmm.
might be a possibility for her. But I know others who seem to have more robust immune system who get that like flu-like response.
Hmm.
Is that a reaction from a stronger immune system or
It could be because when you see sometimes with autoimmune conditions, your system could be overly active where they're having like a huge pro-inflammatory response that's unnecessary. And that's what I say for people that have chronic Lyme, is that I worry of, you got exposed to a tick. Why is it one person, to your point, look, we'll get antibiotics, fine, cleared, no symptoms. They don't have any issue again. And then other people are like struggling with it for 10 or 20 years. In my opinion, that's because there's some kind of immune dysregulation. And that's when I get concerned, is this like kind of an autoimmune process beginning, because the immune system is still fighting or going after something that's like kind of no longer really should be active or there, versus somebody who's responding right away promptly, they get treated, and their system like goes back to, basically goes back to homeostasis, versus a person that's still going after something that's not supposed to be there. So I think it could I think it could depend on, because if you look at tests, for example, like Lyme Literate vendors like IGeneX, this is where tests like PCR testing, or what they call direct testing, is helpful. like fish testing, et cetera, because basically it's testing, it's more focused on seeing the active amount like in the blood versus antibodies. Because some people whose immune system is blunted, they don't produce enough antibodies. So you'll also will see that where somebody is like, they have all the symptoms, clinically they present with that, and that's probably why they say it's a clinical diagnosis, but then you test them and it's negative. So that's when you might need to do like PCR testing, fish testing, because it's something around 15% of people don't produce enough antibodies to even show. So you might be missing about, those people because their immune system is more blunted, or a person that has an autoimmune condition that is on a lot of immune suppressants. That might also prevent their system from being as active to show that antibody response as well. So I guess I wouldn't say, because sometimes with autoimmune conditions, it could actually be the opposite, where your body is like going way too far with kind of attacking, and then sometimes it could just be that it's not as active because the immune response has been blunted, and it could kind of be. I see it for both. I guess that's what I'm saying in terms of, it doesn't necessarily mean one is better than the other, but it might mean that different testing needs to take place to be really clear.
Right. That's super helpful. And just kind of highlights the fact that there's a lot to know.
Exactly. It's a
And
whole, and we don't learn this in medical school. Like
right.
when you just learn, okay, what it is, 5 bands to be positive, IgG, 2 bands to be positive, IgM. You don't learn all these kind of nuances. And so that's what causes some confusion also for patients, or sometimes that's why I do a lot of training with doctors in functional medicine that are getting into Lyme disease, and why some don't want to even touch it because they feel like it's so nuanced and so complicated.
Yeah.
But it's not once you're getting into it. But it's I think it's when it relates to your immune system, your body can do so many different things. So it's not a cut black and white kind of thing. So.
Right. And how do people find a Lyme literate doctor?
So ILADS is a great one. So that's ILADS. And so those are Lyme literate doctors. There's a mix. So some just do medication where they might do different antibiotics. Someone like me does it through integrative medicine and functional medicine. However, if I do think it's warranted for someone to be on antibiotics, we do have, a team of providers that will help. Because I definitely think in some cases is warranted, in certain situations, depending on, occurs, especially if it's like more recent infection. So I do try to blend both for what's the most important for the best needs of the patients. Personally, don't like really long-term antibiotics past 3 to 6 months. But on ILADS, that's actually a great way to get a resource for a provider that's trained in Lyme disease.
Okay. So my focal area has been kind of brain health, um, after my functional medicine training. And then I did training with Dr. Bredesen at
Oh
Apollo
yeah.
Health. And Lyme is kind of a little, little space that can contribute to dementia and
Mm-hmm.
Alzheimer's, as other infections can also show the same similar clinical responses, like with herpes or P. gingivalis.
Mm-hmm.
Um, and I've heard that sometimes it's extremely challenging to treat. And I heard about one patient. This is just a case study that it's been years ago now, and I haven't heard the end result. Who went to Europe to like have a fever induction,
Oh yes.
basically,
Yep.
like
Mhm, mhm.
104,
Yep.
105
And they
degrees.
actually put you on like anesthesia under,
Yeah.
to do that.
What do you know about that? Are there any like out there treatments that have been potentially impactful?
Yeah, they're definitely, and they're in different countries. Like Germany has it, Mexico,
Mhm.
and so there's like hyperthermia, and they will put you in anesthesia, and they will, because you couldn't tolerate, 104 degrees and be awake for that. And those places will do, and so it has shown to be pretty helpful because the spirochetes can't live in a certain temperature. So that's the thought process behind that. And a lot of those, like kind of those retreat centers that focus on that, they also do include hyperbaric. They also do IV, which we do at our office, like IV nutrient therapy. So they might do things like glutathione, um, and antioxidants, because Lyme disease impacts the mitochondria. So you'll see people be more tired. their energy's lower, et cetera. And things like those antioxidants are really important for brain health too. So things like IV nutrients are also really helpful. Um, Ozone has been another one that people have been doing, which is different therapy. And also SOT is another one, but pretty expensive. It's like $10,000 worth of treatment, which is focused on like RNA. It's very, very expensive. So it's kind of one of those things, same as the hyperthermia treats people do kind of as a after they've tried everything else and that
Mhm.
hasn't worked, because they're pretty costly. I definitely have had some people do that treatment. I've had some help with it. It's just I think if you can get minimally invasive treatments first, that's more
Right.
ideal, than for those two as well. So, but there aren't any in America like that because it's not authorized. So,
Okay. My understanding is the reason why they do this induced hyperthermia, is that
mhm, mhm,
right? Um, is because the spirochetes, they're kind of like corkscrew.
mhm.
They can burrow into cells and hide and form little cysts, and so they're protected, but they're still in there. Is that right? And so
Yes,
the
and
hide.
it breaks the cyst, and so that's also happens. Some antibiotics can get your uh the line in terms of like more cystic or stationary form, and when it's like that they call like round body forms. You'll see names like that when you're kind of doing research. What happens is it just makes it harder for things like antibiotics or any treatment to work because it's more, for lack of a better word, like stubborn, because it needs to be kind of broken open. So like the hyperthermia treatments help with that. The other thing is you want to look at things that help with what's called biofilm. So biofilm, like any of the tick-borne diseases, produce a lot of biofilm, which is basically this like kind of bacterial uh that kind of basically sticks onto things. So you need like these fibrolytic enzymes like nattokinase or serrapeptidase or lumbrokinase to break it up, because it kind of hides behind it. It allows a spirochete to hide behind the host. And so you're not allowing things to kind of penetrate and get these ones that are like deeply burrowed. So I always tell people, make sure you're on something to help with biofilm as well, if you're on antibiotics or if you're on integrated medicine or any like herbal medicine, because the people that usually struggle with these tick-borne diseases for a long time, it's often they have a lot of biofilm, and that's where these things are like hiding under. And so you need to really target the biofilm as well. But also some antibiotics, if you look at minocycline, those help with things like MMP9, and MMP9 is one of the top markers for like not only like arthritis but also brain inflammation. So when you look at some of the antibiotics, some of the things they target help with like brain, like neuroinflammation, which occurs due to these tick-borne diseases, and many just treatments in general will help with those kind of factors that are connected to like current and active neuroinflammation, which causes symptoms of brain fog, dizziness, any neurological issues. Period.
Yeah. Yeah, one of my clients was diagnosed with Alzheimer's and was told she had Alzheimer's, and but when she was treated for Lyme and mold,
Mhm. Completely better.
she's
Oh,
functionally,
yeah,
yeah,
I've had
just
people
fine.
get treated, they started writing better. I've had people come in that one of the common things, and I'm sure you've heard, is like, I have these ideas in my head, but I can't like verbally, it's the like the I hear it, but I know what it is, but I can't say it. So it's almost like they feel like a slight dementia or short-term memory issues, things like that. And then you'll see after they go into Lyme treatment, like that's not an issue, like recall is not an issue, short-term memory, mixing up words, fogginess. And so also we put patients on something to help with what's called like lymphatics, because you have lymph throughout your body and you also have it in like the glial cell in the brain. And so basically these viruses just also can affect the lymph. So we also do things to help support the increased blood flow to the brain, but also clearing of the lymph, which can also cause the brain fog. And that's just related to chronic infection.
Okay, so I'm familiar with movement
Mhm.
and lymphatic massage to
Mhm.
help, rebounding. What else are ways that you can help with the lymphatic and
Yeah, so
lymphatic?
some of the herbs, like cleavers is one.
Mm.
Cleavers is the big one that we use a lot. Also things that help move like the liver, like dandelion leaf, dandelion
Okay.
root. What you mentioned, like dry skin brushing, castor oil, on the abdominal area are helpful. The one that we use has cleavers and also has ginkgo, because ginkgo increases the blood flow to the brain, increases vasodilation. So we'll do those as well.
Okay. Yeah. I love when I learn things, learn new
And
things.
sauna, actually, the far infrared sauna too does move the lymph and moves and increases the circulation.
Okay, fantastic. So we had, a big focus on Lyme disease. We touched on the relationship between um, how the body might respond differently to Lyme if there's already an autoimmune disease there, but also how untreated Lyme could potentially contribute to a later diagnosis of autoimmune disease. We talked a little bit about how both of those things can impact the brain, um, and cognitive symptoms that might appear due to Lyme. Um, what else do you want to share? I want to be mindful of your
Oh
time.
yeah,
But
I
yeah.
think I always tell people, if you're getting these symptoms that are just obscure, like I mentioned, migratory joint pain, anxiety for no reason, sleep issues, just symptoms that are vague, definitely, first seek care with your primary care doctor because you want to rule out any just general situations. But if they've been happening for a while and you're not getting answers, definitely look at some tick-borne disease infections. Definitely look at other just infections that can contribute because it's not in your head. A lot of people are told that it's in their head and they're just anxious, and you know yourself and you know your body more than you think. I think than any doctor, than any provider would know. You know your body. So I just always say, stay true to that gut instinct, but also know that there is ability. Because one of the things is when you look at research out there, people can get really fearful because they go on Facebook groups, as you know, with like Lyme disease, and oh my God, I'm going to be in a wheelchair and I'm going to not be able to walk, or I'm going to have Alzheimer's. Yes, that is true. There are some people that happens to, but by and far, most that doesn't. So it's really important to stay hopeful, not to let it define who you are, and realize there's a way out. And if you're not getting that also from the person you're working with, you might need to seek another person. You want to work with the provider that instills hope, because I also see sometimes it ends up being very fear-based, and but there's a, what do you call it, the light at the end of the tunnel, but you also have to be mindful of like that energy around the disease condition and ways to get to solution rather than fear. And so I always say that that's really important, but definitely it's not in your head. Make sure to continue to push and ask, and until you get a person that hears and listens to you to actually make sure that you're properly treated.
I love, love, love that you highlighted that.
Mhm.
And on that note, how can people find you?
Oh, yes. Yeah. So I run the practice in Connecticut. It's fairfieldfamilyhealth.com. And it's interesting because we all have different specialties. So mine often is Lyme, autoimmune, also psychiatry. So we have lots of people that have anxiety and depression with Lyme also. And so that's my area of focus. But we also have other doctors like Dr. Medea, who also is trained with Bredesen protocol, that does
Mm.
like Alzheimer's, Parkinson's, MS as well, and Lyme. So all the doctors in our office are trained in Lyme, but we have a little bit of different focus areas. We have one that does, for example, naturopathic oncology. So that was really important to us in how we make sure that we meet the immediate needs of the patient. So fairfieldfamilyhealth.com, and then Instagram, my account is at naturopathic.physician. So feel free to connect with me on that as well.
Fantastic. I greatly appreciate you, the time that you gave today, the information that you shared. I'm grateful. Thank you so much for
Thank
being
you.
here, Dr.
And thank you
Patterson.
for sharing this information out to your community and at large, because it's very important. That's the only way we're going to keep people from also not seeing. My goal, I always say when I train doctors, because I often train doctors in functional medicine and with Lyme disease, and I say I want to be like the first. My goal is like that you guys are the first doctors that get the diagnosis correct from the beginning,
Right,
not the seventh to ninth doctor.
right.
So having, these podcasts, having these discussions, putting this out helps to prevent that, because it would take a lot longer to get diagnosed with that. So thank you for this podcast.
Awesome. Yep, my pleasure.